Good afternoon, everyone, and welcome. I'm Dr. Polly Wong. I'm a lecturer from the School of Public Health here at the University of Hong Kong. I want to thank you, everyone, for joining us today in this Global Health and Development student webinar series, Exploring Public Health and Global Health Careers. So today we're very excited for you to join this career talk. And amongst our audience, we have a wide range of participants, including secondary school students. We have prospective and current undergraduate and postgraduate students. And we also have professionals across various sectors and industries. So today we are extremely delighted to have Dr. Nason Tan join us today. He's going to share with us his personal career journey and also to give us some perspective as to what a career in public and global health looks like. So just a quick overview of the structure of this hour. I will have a casual conversation with Nason for about 45 minutes, and then we have reserved the last 15 minutes for Q&A. So if you have a question for Nason, you can use the Q&A function in the bottom, so on the bottom of your Zoom screen, and you can type your questions in Q&A, and our team will be able to read your question and ask Nason the question. Okay. So we will just get started. Okay, so without further ado, allow me to introduce to you our guest this afternoon, Dr. Nason Tan. I'm super excited to talk to him on a personal level because I do know Nason both on a professional and a personal level. And every time we have a conversation, it's always an insightful and delightful one. And I'm very happy that you as the audience can join us today. So allow me to do a very brief introduction for Nason. Nason is a Malaysian physician with public health background. He's also our alumni of the Master Public Health program here at HKU. In addition to his clinical training, he also has a wealth of experience in various sectors in healthcare, including working in fines doctor service, working in a government hospital in Kuala Lumpur, and also has done many, many humanitarian missions all across the world. So currently, he's the Regional Operations Support Unit Director of Médecins Sans Frontières, MSF Hong Kong. So MSF is an international, independent medical humanitarian organization that brings assistance to areas of conflicts, war, natural disasters, epidemics, and healthcare exclusions. MSF is also currently one of our practicum organization for the students in our MPH program currently, and we're currently in active discussion with MSF to become one of our organizations as a 6-month overseas field placement for our Bachelor's of Arts and Science GHD program. Okay, so hi Nason. So thank you for joining us today. So we'll just get started because I have lots of questions for you, and we would just love to hear how you are.
Hi, Polly. Thank you so much for having me here today. It's really an honor. On behalf of MSF Hong Kong, I really cannot thank you enough. But I'm just so excited to be seeing you after quite some time already since we last met. So yeah, thank you so much for having me.
Okay, so Nason, we'll start with the questions. So I was only able to briefly introduce you just now. So can you share with us your career and maybe your education journey? And how did you go about to pursue your career in public and global health?
Right. So I'm not sure whether this is a good time to share my boring journey or not, but I'll try to make it more interesting. So I graduated from India. I think my medical degree graduated in late 90s. And I came back to Malaysia and attached with the Ministry of and service for more than a decade. So I was involved mainly with the rural service, the flying doctor service in Borneo, before finally landing for a couple of years working at a tertiary hospital. Finally left the government service for more than a decade, and I was correct because at that time I was thinking something must be more interesting in life and not just clinical per se. So that's why I took a career break and actually on my own. I spent 3 months there in the Tibetan refugee settlement camp where I volunteered as an English teacher in the morning, and also as the voluntary doctor in the health clinic in the refugees camp for 3 months. And then following that, when I returned to Malaysia, I received a call from MSF to go for an interview. And then, the rest is history as I started my journey with MSF, first as a field worker. I did some amazing humanitarian missions, in emergency missions in Ethiopia and Sierra Leone, Cambodia, and also Indonesia. And also as a board director for a couple of years, and now as the one of the directors in our MSF Hong Kong office. So it has been quite a journey, I would say. As for how they end up as picking up the MPH in Hong Kong U. So that came about when I discovered that you always feel inadequate. There's always so much that you can learn. There's so much. This is what I want to do to learn more, and therefore get the MPH, which is really useful to my career per se. So that's how things have been.
Yeah, thank you. So my next question for you, Nason, would be what motivated you to make the transition from clinical work to working in global and public health?
So I think it's the exposure in the MSF missions when I was on the field. When I saw those things and I realized that, of course, you have certain profiles when you're on the field when you do certain things. As in, as a doctor, you have a clinical profile. That's where you do your work and perform your role and responsibility. But I learned that in a lot of missions, you are being asked, to cover quite a number of things as well, or to be responsible for a lot of things, such as the pharmacy inventory or even the logisticians, somebody to cover for them. So there's a lot more being involved than just pure clinical work. And actually, these things, the whole, if you step back and look at it, whatever that's related to medical affairs and public health per se, I think those are what really interests me in the first place, and also to find out more about it and how I can then be more useful in all these humanitarian missions and also in my work per se.
Thank you. So my next question for you involves the current work in MSF and also the work that MSF does. Can you share a little bit with us your current projects at MSF, or possibly projects you're looking forward to in the near future?
Right. So I think right now what's happening around the world is the pandemic, the COVID-19, and MSF has been involved in the pandemic. We've been doing work concerning particularly three pillars. The first one is supporting the authorities, to provide care for COVID patients. And then we also try to protect people who are vulnerable and also at risk. And then the last pillar will be keeping the essential medical services running. So for the last 1 year plus, this is I think really on a global scale, and also operating in certain places that we weren't operating before, such as United States or even in Europe. So it's really on a global scale that we've been doing a lot of COVID work. And when we first started the COVID project, it was actually in Hong Kong in January 2020. And that was even before the WHO say that it's a pandemic. So I'm actually I feel very proud for Hong Kong that the first MSF COVID project was actually in Hong Kong itself. And if you ask me about the sort of future, what we are going to look forward to in the future, I think we'll still be seeing this pandemic being, slowly unfolding. Now, I'm sure you have heard all these news on Brazil, so India, how bad the COVID situation is over there. And we expect that this current pandemic to go on for at least 1 more year. And we are really in the middle of what I would say clinically as a COVID hurricane. You have the delayed vaccination, you have the COVID virus being, mutated, and then you have people who are suffering from pandemic fatigue. So you have these factors that are causing the COVID hurricane. We actually say that we will still be seeing a lot of COVID projects in the future. And don't forget about the knock-on effects of COVID. As you know, COVID doesn't just impact on the patient directly health-wise, but also on the health systems, on those existing essential services. And we know the SDGs have all been definitely set back many years. So we are definitely going to see a lot of all this setback. And I think it's also an interesting time for your students to be able to analyze or kind of like project in the future post-COVID impact as the public health or global health, where the health needs or the gaps are. And I think your students will be right to come at just the right time to help us tackle this situation.
Thank you for such a detailed answer. So Nason was just telling us about his current works and his current projects in MSF, and I will move on to our next questions. And we wanted to ask you, in terms of the current and future works of MSF as an organization, as a humanitarian organization, what are some impacts you see for MSF on global public health?
I think what we'll be seeing more, or actually even right now in global health, I think it's the climate change. And we are talking about planetary health nowadays. It's no longer just about a simple thing as climate change, but rather looking at it from a planetary level. I think that's where the humanitarian and so the development, most of the organizations will be looking at really closely. So I think this will be an area, especially for us here in Asia Pacific, as we are so prone to natural disasters and the effect of all the climate change. So I would foresee that this is definitely an area where most of the organizations will actually be watching closely.
Yeah, so I think my next question is keeping it real time. And you've also talked about COVID in my earlier question, but this question is now specifically about, from MSF's point of view, how is the situation of COVID-19 pandemic around the world, especially its impact in developing countries?
Right, so as I mentioned, that's the Category 5 COVID hurricane that was seen in Brazil and in India. So there's definitely factors such as delayed vaccination. Most of these developing countries, they are not receiving the amount of vaccines they would like to receive, and they are still further down the line or the queue to have so, and trying to roll out the national vaccination plan. So therefore, we would see delay in this vaccination campaign, but we are also seeing people feeling fatigued because of the pandemic for so long, and therefore might be a bit relaxed in their prevention activities, and therefore can see a spike in the infections again. So if you look at the world today, based on WHO, that's more than coming to 150 million cases, and also 3 million deaths, about 960 million doses of vaccines being given throughout the world. But if you break down statistics-wise, not that many going to the developing countries. And this is one area where MSF is particularly, hope to raise the awareness on, the equity in getting the vaccines for our field workers in the developing countries. Let's talk about India and Brazil. So as we see, they are not doing that well as well. And therefore, for MSF, we are scaling up our services in support of the health facilities in those areas, and also really trying to scale up our services and provide whatever support that we could. So that's the current, I would say, the situation is for us right now.
Thank you. So my next question is, we wanted to know what are some challenges that you and your team are currently facing at the moment?
So, well, this is one of it, which is doing a lot of things online. So technology, of course, we have all these little hiccups and so on. A lot of things not able to be physically there. So it does affect our staff workers, our field workers from traveling. There's travel restriction as most of the borders are actually closed. Not only preventing field workers going for mission, but also preventing essential medical supplies reaching our programs. So these are the main two problems that we are facing. As I mentioned also, we are not just trying to support the most of the health authorities in providing their health services to the general public, but we're also trying to make sure that they are able to respond to sudden emergencies that might happen. And also we want to make sure that our programs can be kept on running. So as you can see, it's really not easy. It does aggravate a lot of vulnerabilities in the different health systems where we work. So ours is pretty challenging, and it's not just on a very focused or localized sort of scale, but rather on a global scale to speak.
Yeah. So Nason, your line of work deals with so many key areas. We're talking about from planning to organizing, to coordinating, and then you need to negotiate and communicate with various stakeholders, and also wanting finally to execute certain health programs or health services for the underserved populations. And then there's also the evaluation part afterwards. I mean, this is such an intrinsic area and so many key process of this whole entire process. Which parts of this process do you find most challenging or / most rewarding?
That's a difficult question for me, actually, because I think I would say that I enjoy most is the process, not so much of the outcomes. I'm more of a process sort of person rather than outcome or goal driven. So for me, it's the process I enjoy, be it planning or organizing or even getting people from the different opinions or different come together, whatever. For me, it's the process of how we get to whatever we want to get to. So even if the outcome is not something that you would expect, but I would treasure the process. So I'm more of a process person. Yeah.
Okay, so my next question is also working in MSF and also such a global organization. I mean, you come from such a vast experience working in different cultures, working with people, different cultures too. So could you talk a little bit about your experience with working with people in different cultures?
I think my being a Malaysian, so from small, we were exposed to so many cultures, so many different ethnic groups, languages, food, music, and everything. So that has sensitized me to all the different cultures, and therefore for me, it's something that I enjoy seeing, that I enjoy immersing myself in the difference in the culture, and for me, it's just a beautiful thing. It's really a kaleidoscope. So the other thing that I particularly interested in is history. So for example, if I go for a mission in, let's say, Ethiopia, I would actually read up on the history of the people there. So if you know, Ethiopia has not been colonized by any foreign countries. So they are actually a group of very proud people. And therefore you need to know with that sort of where they come from, then how would you deal with that? Giving constructive feedback might not be that simple, so how would you then phrase the way you want to talk to them? So therefore, I think it's being sensitive to the particular culture and being very aware of the difference in all this culture.
Right, and a lot of misunderstandings maybe across different cultures could have been if everyone have a bit more knowledge or understanding the situation, keeping an open mind about things, and that would be helpful with the culture interactions.
Totally agree.
Yeah. So my next set of questions talk about more career related as questions. So Nason, you have had such a fascinating career, and many of our audience today, they may just be starting out. They may just be students looking to pursue a career in public and global health, or maybe to do a study in public and global health. And now, from a career point of view for global and public health, many things attract individuals to pursue this career. Either wanting to improve health locally, wanting to improve health locally and globally, and a desire to make an impact in the world. However, the challenge also lies in this career path because it can be quite convoluted sometimes. And it's not necessarily as straightforward as, say, like a professional degree or a medical clinical degree. So with this regards, I have set some career related questions for you. we get many students ask this also. How would we define, or how would you define a public health and global health career?
For me, it's a noble profession with the intention to improve the quality and making impact in people's lives. That's how I would define public health and global health. It's also a very broad discipline, and that's what is fascinating, and at the same time, it's very motivating because you always have something new to learn. It's not something dead that you learn it today and then that's it. You don't have to kind of like find out more about it later on. So for me, it's more about the learning process and how to keep yourself motivated. And therefore, public health and global health would definitely provide this sort of encouragement and motivation for me to kind of pursue this career. That's how I would say.
Yeah, and we want advice. We want some of your expertise advice. So what advice would you have for students that are looking to enter global health, some are prospective students and also current students that may already be in this area, if they want to be looking for work in this field? Those students that are looking to enter global health or public health, and those students or personnel that are passionate to make a difference in the world, making an impact in this world, what kind of advice would you have for them?
I can talk on this for one whole day, but it's because I think I'm old enough to rather to share the wisdom, sharing from my own personal journey. Let's take myself, if I may. I did not set out any particular goals. I'm not a goal-driven person. I'm more of a constantly inventing myself along the way. So for me, it was never really about, oh, by 30 years old, I need to be this specialist. By 40 years old, I need to have cars, condominium, and whatever. I was never like that. So I was one of the weird ones, and more of like a disappointment to my parents. But what I would like to say is that you do have, it depends what sort of personality you have. So some people are very goal-driven. There's nothing wrong with that. I have friends who, even before graduating medical school, they really say, I want to do gynecology. I know what my plan is. And by 30 years old, I do this or this. So which is good for them. They have this particular plan. Whereas for me, I'm not a goal-driven person. I'm more of like going with the flow. And when there are opportunities which fit into my current, I would say the working identity and so my personal values, then I would pursue it. So that's how I've been kind of like rolling along. So it's whether it depends on your personal attitude, your values, your passion, and what skills you have and what skills you do not have. So you need to have this insight. And if you see you do not have this particular skills, then you need to improve on it so that when the next chance comes, you can actually grab on it and kind of like develop further and proceed further. So I don't know whether that make any sense to your students or not.
I'm sure it does. I think it's something that they need to take, and they also need to take it in, absorb it, and then how to actually practically apply it. So my next question is, in your experience, you probably have worked with many people, you probably have interviewed a lot of candidates for your team. What qualities do you see that stands out the most? Or in terms of shortcutting the question, what are some key skills and competencies that you would look for?
So I mean, of course, the basic knowledge, that the core competency will be performing the particular role that or position that you're applying for. That's a given, and that's actually quite. I would say it's the same for a lot of candidates. It doesn't differ, whether someone comes from this background, that background, but they have the same knowledge. So for me, that is, it won't be something that able to single you out to us, when we interview you. For me personally, soft skills are what I would look for, because that is something that's very difficult to teach. It's also something that you need to develop over time based on your own personal experience, your own observation, and how you would cultivate that. So I would look at soft skills as a particular, sort of feature that would distinguish candidate from the other one. So if I may elaborate a bit on which particular soft skills I'm looking for nowadays. So the first one is that I need to know you're a simple person, that thinking process, that critical skills are there. that you're able to think things sensible, that you know when you need help. For me, that's the most important. You need to be a safe person. And then the second thing will be on the interpersonal skills and communication skills, emotional intelligence, empathy. So these are the things that I would particularly look for.
Yeah, I think those are very, like we said, the soft skills are very what many employers would look for. And you also mentioned before you want at least have a basic knowledge or key competencies. What kind of key competencies would you say is needed to work in if I want to pursue in a career similar to yours or reflecting into global health and public health?
I think it'll be the leadership skill, and of course, as I mentioned, broad knowledge, because nowadays everyone is a global citizen. You cannot afford to not know what's going on the other side of the world and how it does affect or impact the population that you are interested to serve. So I think it will be very broad knowledge on the various disciplines, how they intersect and how they would actually require your knowledge and skills to apply in order to achieve what you plan to do.
Thank you. So my next question also related to career. What have or has been the most important lessons that you have learned during your career so far that you could share with us?
So I think for me personally, it's to have an open mind, as in, a lot of us very often we take our jobs based on what is available in the market. As you know, this market is very tough. It's very dynamic, the employment field we're talking about. So a lot of us usually take the resistance. We would be, getting jobs that are easily available, but might not be satisfying, to our passion or our skills per se. So I would say that perseverance is one thing. Whether for you, as in, like I mentioned, based on your personal values, passion is more important to you, or the skills are more important to you, or are you able to find a job where you can satisfy both your passion and also your skills, and also rewarding in that sense. So there's no particular black and white or fixed rule for anyone, I would say. Just make sure that you understand yourself first. You need to be aware to have an insight of your needs, your values, how you decide things, your usual decision-making process, what other factors should influence your decision-making process. I think just be open to all these opportunities that may arise, and then go with the flow.
Go with the flow, yeah. That's probably maybe we can just So let's say if there's a redo or reset button, do you think you would have done anything differently from your start to where you are now? Or do you think, you know what, I got here as things came on to me as experiences, and also different parties came so differently. So how would you do anything differently? Or do you think this is how I would have done it if you gave me this another chance?
Whether there's any regrets, is it, and whether I would reset the whole thing, right? No, I would not actually. I think I believe very much in timing and what opportunities present themselves, in front of you, and whether you recognize those as opportunities or not. So I'm a great believer in timing and whatever opportunities that might arise. Whether you recognize that or not as something that you would like to do or not, I think it's very individualistic. So therefore, let's say if I continue to pursue a clinical career, it will be to specialize in pediatrics, because I do love children. But I would think I might not. Now looking back, having this luxury, I think I would enjoy more being a humanitarian rather than a pediatrician. So therefore, I don't think I would kind of like try to reset anything, because honestly, I think the exposure and all these experiences on so many different levels and in various countries, they've been extremely enriching, very fulfilling for me. So I wouldn't change a thing.
Thank you. Thank you. So I see that we do have a lot of questions coming in, and I do want
No.
to reserve some time so then we do have questions taken from our audience. So I will actually start taking questions from the audience now. And I want to also take this reminder, if you have any other questions or just keep typing in the Q&A, rest assured that our team is looking at the questions, so then we can read it up to Nason for him to answer. So there's a Q&A function at the bottom of your Zoom, so go ahead and type away. Okay, so we have some questions for Nason. Okay, so we have this question from asking, for people like me who don't have clinical or doctor training, can I still pursue a career in global health or working in a global organization like MSF?
Right. I want to let you know that the name might be Doctors Without Borders, but majority of our staff are non-medical, and they are the backbone of our organization. So I would like to pay my tribute to all our non-medical staff in MSF. We have logisticians, we have finance people, we have fundraisers. Without them, we won't be able to do our project. So there are a lot of people being involved. I would not feel discouraged. Instead, I would encourage you, if you do have the passion, to join humanitarian organization. It's not necessary, to be a medical profile per se, or try to but it would be nice if we can get a public health, or I'm not promoting for Hong Kong. It would be nice to have a public health background, because I think it does help me on many levels. Of course, you can have economics background. You can still join, any humanitarian organization. But I think, as I mentioned, nowadays the employment field is so competitive. What can differentiate one candidate from the other candidate is based on knowledge, skills, and also the soft skills I was talking about. If you can have something, knowledge in very broad fields that's related to public health, not just medical per se, I think that would be a good start. Yeah.
Okay, yeah, because I think many of our students either wanting to pursue our undergraduate or postgraduate program, they're not sure like what kind of areas are out there, what kind of opportunities are out there if I don't have a medical background. So I think your sharing of your idea of, as an MSF, these are the backbone. We need these people in terms of supporting whatever the front end is, and they're just as important as the medical doctors that are out on the humanitarian missions. So I hope that answers this question. There are some not questions, but I think just hi. So I just want to say that to you. So we have a James who is saying that he's living and working here in Thailand. So it's just good evening and hello. We have a question. We have a question from Christine, and Christine asks, working in a global/international organization, do you travel a lot? That's our first question. Or the second question, and then the remainder of her question is, or is it mainly through phone? So her question is, do you travel a lot, or is it basically through phone, computer work? And did any of these routines change and affect you a lot when COVID hit?
Right. So I think I answer more on a general level than on a personal level. So as I mentioned, when COVID hit, there were a lot of travel restrictions for our field workers and also personnel. So we weren't able to travel so much because of all this travel restriction. And therefore, we use a lot of online technology in order to do meetings and so on and so forth. So definitely that has been the biggest change that we adopt, and also working from home due to the COVID situation. So it's also adjusting the mental and your social habits. So these are all very interesting areas that I'm sure you'll be doing a lot of research in the future. So how do we, as usual social human being, adjust in this new COVID environment? We lack social touch nowadays. We cannot hug our patients. We cannot tell them everything's good. And, we lack that human touch, that personal touch, to make our work more meaningful. So it's trying to adjust to all this, and definitely it's very challenging, area that we are facing right now.
Thank you. So our next question is from Joshua, but I think Joshua, I can probably answer Joshua's question. He might have just missed the first half of our talk. So Joshua is asking, what's your role? So in case everyone who have joined the audience have missed it, so Dr. Nason Tan is actually the Regional Operations Support Unit Director of Medical Sans Frontières in MSF Hong Kong. Okay, so next question. So we have a question from what are the requirements for joining MSF? And it's asked by Ronki, who is currently our current MPH student, by the way. So Ronki wants to ask, what are the requirements for joining MSF?
So we have medical profile, we have non-medical profile also. So it depends what sort of profile that you're applying through, you know. And if you look at our msf.hongkong as an HKU website, there's a particular page, you know, when you land, you can see on the different profiles that we are looking for. And then there will be some questions that you need to sit through. You go through your stuff as something like a reflection sort of questions for you to see whether you are suitable or not to pursue this humanitarian field. And then, of course, you know, you submit in your resume, your CV. We'll try to go through, we check the references, and then we'll arrange a meeting, phone line interviews, and then we try to conduct what we call as assessment. So during my time, we were able to meet up physically and actually do 2-3 days assessment. It's part of the prerequisite requirement, you know, before you to see whether you can pass or not. So there are a couple of steps, but I would advise that you go to our website for more detail, all these categories on medical, non-medical field, how you submit your resumes online to, you know, really have a good idea. And please feel free to come up to our Hong Kong office, you know, to hello, is our office, and you are most welcome.
Thank you. So my next question is by Rachel. What are some Hong Kong agencies / organizations student can experience in the field of public or global health?
So I actually get this question a lot. Like, for instance, someone would say, I want to, you know, volunteer, or what sort of community activities I can do. So I would say do your own research, do your own homework, map out the different organizations that you have that's available in your particular area, that you feel that their values align with your passion. The mission of all these organizations align with your value and your passion. And then try to look at their finance or their activity report to see, you know, how their funding goes, to see, you know, how they spend their money, on whether they are accountable to the donors and the beneficiaries or not. So I think in Hong Kong per se, we have a lot of organizations and NGOs doing a lot of significant work, you know, on catering to the elderly, catering to the homeless people, catering to HIV folks, and also injecting substance users. So it depends very much on your passion and whether your value aligns with the organization's mission or not. So I would advise you to do some homework and then just then give them a call or try to write in to see whether there are any opportunities to volunteer or even to do internship. So I think that would be the best approach.
Okay, so we have a question from Ethan. So Ethan is from HKUSD, and he has said he actually read your article on the refugees written by the Jean-Michel asserting MSF to have a global preparation response. I think his question mainly is that he's worried about global bodies such as WHO, or if they don't have permission to do work in sovereign states. What can healthcare workers do to ensure population health in politically unstable parts of the world?
Wow, this is a really broad topic. Let's see how I can. This sounds very much like public health assignment, you know, that we get in our weekly assignment, per se. I think you can tackle this from a lot of levels, system-wise, look from it from a system-wise and try to see where are the different levels that you can actually gain the entry. So it's not easy per se, extremely complicated, very context-driven as well. So I don't have a particular, at this point in time, I'm not able to give you some very good answer, but I would say, have a good overview, see what the context is and try to understand from a system point of view and gain the whatever channel that you could. I'm sorry, I hope that could at least answer half of your question. So sorry for that, but really good question.
So I have a question from Christine, and I think in general, her question is, I think she wants to ask you why you chose MSF of all the other organizations that you have mentioned in terms of careers.
So I think when I was small, there was this, I'm sure most of you were not even born when we actually had the malnutrition emergency crisis in Ethiopia. So there was this on the TV, have this image of the African kid with a bloated tummy, or what we call in medical kwashiorkor. So you have this bloated tummy, but very skinny and bones, And then I saw you have this MSF worker next to that particular kid. And that image has stuck on my mind for many, many years. And despite being a clinician, and finally when I had my career break, somehow this image kept on playing back on my mind. And I was like, yeah, I think MSF is what I really want to do. So for me, it was more of this exposure that I had. It was indented in my memory. If you want a more so-called I don't know, politically correct answer, probably it will be like, I think it's one of the largest international medical organization around. And therefore, the way that it's independent, most of our funds come from the public. Therefore, we're able to do a lot of things not influenced by some political affiliations or what. So that will be the supporting answer that I can have for you.
Thank you. So my next question is, how would you describe a typical day at your job at MSF?
This is getting interesting. I can tell you every day is different, especially now working from home. So right now I'm based in Malaysia, in Kuala Lumpur. I'm still waiting to be relocated to Hong Kong per se. So every day is different. But let's say based on my previous experience working in Hong Kong before coming back, it was also very different because you get all sorts of news or things that are happening very fast that will come to you, online or phone call or from people. So I would say it's very energetic, very energy driven sort of a day. Every day is different, and that's why it makes it very interesting. So it will be a lot of paperwork, a lot of computer, a lot of phone calling, but also a lot of analysis and trying to plan and organize your thoughts. So it's a mixture of a lot of things. But like I said, it's a very exciting job. You'll be tested on so many different levels, on different skills that you have, that you feel every day that you are making a difference.
Thank you. So my next question for our audience is, what skills do you use in your current job and current post at MSF? Current skills. What skills?
So for me, it's more right now, it's a lot on monitoring surveillance and also on the policy analysis that I'm doing for, especially, with the planetary health, the climate change in the Southeast Asia region. So it depends what sort of work that you are into, or rather your position of job, and then you have the different skills that you can use. But for me personally, right now, it's more of analytical skills, trying to do the policies and also to see how best we can manage or support the different operations in the region. So for those who might not know, MSF Hong Kong also support missions in Malaysia, in Indonesia, in the Philippines. So my work is also goes to that particular area to see how we can support best all these different nations in the region.
So my next question for our audience is, what are the current needs in this field?
Current needs, I would say, at one time we had mainly on the gynecologists, anesthesiologists, and also surgeons. So that will forever be a hot, I'm talking about medical field, right? So those will be the hot areas, or rather much sought after professions, or the needs that we are seeing. The other one is more on psychology, mental health support. So this is an area that MSF is looking very much into. So if we look at the health per se, like I mentioned, public health is so broad, so it's not just about health per se, but also on environment. So we are talking about water, sanitation, hygiene. So those sort of things are also important in our projects. So that will also be a key driving force in the future. And then if you try to see or project right now with all this climate change, post-COVID impact, then you would expect what other fields or what other needs to come about. So I can, right now, as I can tell you, I think if you look at tuberculosis, that will be something that I'm sure is going to just spike up like anything for the next few years because of COVID. There's a lot of use of steroids, rampant use of steroids right now to treat COVID patients. And we are not sure how many of them actually have latent tuberculosis. And this steroid might aggravate, all this situation. And we are going to see this sudden surge of tuberculosis. And not to mention because of the COVID, a lot of our tuberculosis screening treatment are also impacted because of it. And so therefore, I would think tuberculosis will be one area that you're going to see. So, and if you just talk about tuberculosis, then you can think about lab services, you can think about contact tracing, you can think about treatment, you can think about prevention, you can think about continuum of care. So just tuberculosis alone, it already encovers so much, and there's so much you can do. I would strongly encourage people to go into public health and global health because that will be the area that's going to be in need for the near future.
So my next question was, what are some opportunities for professional growth?
Opportunities for
Professional growth.
Okay. So in MSF per se, we have our learning and development, for our career. So we do have our human resource team who actually look particularly into each staff and also field workers' career and development growth. So there will be courses that are being organized throughout the year based on either help you to sharpen your medical skills or clinical skills, or even to prepare you for the field, or even a new degree or new master degree. So that's a particular course in, I think it's in the London School of Tropical Medicine that we are organizing with them, which is on global health and also tropical medicine. Perhaps it's something that, Hong Kong U in the future can also organize one.
So we are almost winding down, but I think we just want to try to answer as much as questions as possible, but we will try to end on time. And our next question for you was, what would be a professionally interesting next step for you in your career?
I never think so far. No, because as I mentioned, I'm not a goal-driven person. So so naturally for me, I don't see so many years in front. It's more of enjoying what I have right now and doing the best I can. I don't kind of like envision that particular. I'm sorry, I'm so boring.
No. The next question is, how would you describe the working atmosphere with the purpose and the people you're working with now?
Very vibrant. We have very young, millennials who join us, and this is what I like most about, being exposed to the younger generation. They are so full of life. The way they think is so different from my generation dinosaurs. They value more on the meaning of life and the impact of their work. Whereas for my generation, I think so, if I can speak on behalf of my generation, we value more on the work stability and, whether it doesn't matter whether it's rewarding as such personally, but as long as we're able to bring some money back, it's all right. That's my generation, to have a safe, so-called safety net. But the current younger generation, we are more driven by goals, and more driven by having an impactful and meaningful life. So I actually love the way they think, the way they are more risk-taking compared to my generation. And also when you are exposed to such, all this difference in the generation, then you need to know how you can communicate better with them, how you can make sure that the work that you're doing actually applies to them, and they can see that what they are doing actually is very helpful and making a difference. So for me, it's been a very vibrant culture to work with the younger generations for sure.
Yeah, so because of time, I'm sorry to say we just have one final question for Nathan. So what's the important aspects we need to explore and develop in the field currently? For example, the technology, communication, or policy? And this question is asked by Tang.
Thank you for the question. Communication is very important. There's so much, especially with this particular crisis, COVID crisis that we're having right now. So there's a lot of misinformation going around. So communication will never die off. It will always be a key. Risk communication will be a particular area of public health that I think is very important, and we cannot ignore it. Technology, definitely. We have seen how COVID impacted on the way we use technology nowadays, and definitely innovation. How we can introduce new medicine or new ways of diagnosing certain diseases and those emerging diseases. So definitely these are the three areas that I would pay much attention to.
Okay, thank you. So that's all actually the time we have for Nason today. I sincerely want to thank Nason for joining us this hour, for talking to us for a whole hour, answering my questions and the questions from our audience. We have just learned so much, and I think you've opened our eyes and perspectives on what a career in public and global health would look like. And we're just so grateful for you sharing your experience with us.
No, a pleasure is all mine. I'm so sorry for the hitch in the connection per se, and I also apologize if I'm not able to answer your questions fully. But do write in to our Hong Kong office. I'll try to reply them in when I'm more relaxed sort of way and can give you a full answer, or even visit our Hong Kong office to find out more on our activities, opportunities to volunteer or do internships. So by all means, please, we welcome you all.
Yeah, correct. And I do want to remind everyone, if you are in Hong Kong or if you're in different locations around the globe, I would encourage to NSF in terms of looking at the website internationally and see what kind of opportunities there are. Okay, so thank you very much, Nason, again. And the last 5 minutes, I just have some announcements in terms of for our audience that are here. So let me just share my screen. Okay, so here are some announcements. So for those our students that are in our secondary school or that are looking to be interested into an undergraduate program. So this is the Bachelor of Arts and Science Global Health Development Program here at HKU and SPH. And I want to introduce to you that we have a Global Health and Development Summer Program. And the summer program is essentially the topic of the summer program is about vaccine passports. And you'll have the opportunity to work in teams, you will debate, and you will basically ask the question, is a vaccine passport an opportunity or is it steps toward inequality? So this is, if on the screen, there's a QR code. You can visit the website for more information, or you can also Google or search Global Health and Development Summer Program 2021, and you'll be able to find a bit more information. So I'll just maybe hover for maybe a few more seconds. So in case you need to capture the QR code or just take a screenshot. And okay, and moving on, if you have any questions about the program in terms of GHD, or if you have questions about the program itself, please feel free to visit the GHD website, which is on your left, or again, you can search the Bachelor of Arts and Science GHD at HKU. And our email is in there, and phone number is also attached, and we're also on social media and Instagram and Facebook. Okay, and for those of you that are interested in our postgraduate program, this is our MPH. So this, if you have interested in to apply or you're interested to take a master level and you want to have more competencies and knowledge about how to develop this career in global health and public health, you can follow on the inquiry also, and also the email addresses, and also our Facebook, Twitter, and YouTube, and also Instagram. Search HKU MPH. And finally, if you're interested into these kind of career talks and you want to be updated, so we do have these career talks on and off, please welcome to join our LinkedIn page. We are the Professional Development Hub, and we on and off, we try to have different career talks, and we invite professionals from different industries and organizations to come and speak to us. So this is the end of our webinar session. I want to thank everyone for joining us today and spending the afternoon listening to Nason and I talk. I wish everyone stay well, stay healthy, and stay safe.